Hello friends, I am Dr. A.S. Prakash, consultant diabetologist and physician doing practice at Dr. Prakash Diabetes Specialty Center, Police Colony, Anishabad, Patna. As we know that hypertension is one of the leading cause of kidney diseases. So today I am going to discuss about this, that impact of hypertension on our kidneys. So first of all, we will know that what is blood pressure. The pressure exerted by the blood on the arteries is called blood pressure. As we know that heart pumps the blood and the pressure is there on the walls of the arteries. If the pressure is more than the normal pressure, then there will be chances of hypertension, and that will actually damage our arteries, and that will lead to narrow the arteries, and sometimes arteries will be very constricted, and ultimately what happens, it will lead to decrease the blood circulation in our various organs, and kidney is one of them. So if there is decrease in the blood circulation in the kidneys, the kidney works not well, and the function of kidney, we know that it is filtration. So kidney is unable to filter the water, filter the electrolytes, filter the proteins properly, and the effective glomerular filtration rate, the filtration rate of the kidney will decrease, and ultimately there will be development of high intraglomerular pressure in the kidneys, and that will lead to develop chronic kidney disease. And sometimes mild to moderate increase in the blood pressure also lead to develop kidney disease. So today is a very important topic, that is impact of hypertension on our kidneys. We can protect our kidneys by controlling the hypertension properly. So first we have to discuss about the magnitude of this problem. As we know that more than 40% diabetic patients are suffering from chronic kidney disease, and more than 30% hypertensive patients have chronic kidney disease. So if you have hypertension, you are prone to develop chronic kidney disease if your blood pressure is not under control. So how can you diagnose that your hypertension is going to affect your kidneys? Although hypertension is a silent killer and there is no symptoms of hypertension, most of the people are diagnosed hypertension randomly, that when they go to the clinics or for screening of any examination, their blood pressure is checked and that is above the normal range. But sometimes patients have some symptoms of hypertension also, like headache, shortness of breath, myalgia, and sometimes there is development of decrease in sleep also. So hypertension is very important to diagnose early in their life. So we have to check the blood pressure at a regular interval. Our Asian phenotype, our Indian patients are more prone to develop hypertension. So if you are hypertension, you may have chronic kidney disease also. So how can you diagnose the kidney disease? Normally early kidney disease does not have any symptoms. Sometimes patients have excessive urination, that is hyperfiltration. Sometimes patients have some edema in their feet, that is pedal edema. When they press their feet, it is pitting edema is there. Why there is pitting edema in their legs? There may be due to decrease in the water filtration, and there is water retention, fluid retention in their body, that may lead to develop pedal edema. Sometimes there may be edema in their body, in their hands also. So whenever you have symptoms, you must screen for the kidney disease. How can you check the kidney disease? First we have to do some blood tests for diagnosing the chronic kidney disease, and that is first is effective calculation of effective glomerular filtration rate. Normal glomerular filtration rate is more than 90. So if it is below 90, you may have a chronic kidney disease. It has 5 stages, stages 1 to stage 5. And secondly, we can check kidney profile test, renal profile test we usually do our patients, that is serum creatinine, blood urea, Electrolytes we regularly check. We check for the urine albumin secretion also, that is microalbumin or albumin creatinine ratio. And if albumin creatinine ratio is more than 30, the patient is excreting the protein from their body, and that indicates that kidney is unable to filter the proteins, and protein there is leakage of protein from the urine, and that will ultimately lead to decrease in the muscle mass also. Apart from that, we have to check the hemoglobin also, because sometimes there may be decrease in the hemoglobin levels, and that is ultimately uh, uh, decrease the function of our renal system also. So there are many symptoms are there of kidney disease. The patient should be aware of that whatever the problem, the patient must discuss with their doctor and do their regular checkup. So how can we check our blood pressure? We know that blood pressure can be monitored by a blood pressure instrument or sphygmomanometer. Usually the normal blood pressure for a normal individual or normal weight person is 120 by 80 mm of Hg. But sometimes patient blood pressure is high, more than 130 by 90, then the patient is diagnosed with hypertension. Usually we diagnosed hypertension by taking the blood pressure at least 2 to 3 times in a patient at different time of a day, so that we can know that patient do not have any white coat hypertension, or patients sometimes have stress induced hypertension also, but that should be ruled out. So we have to check 2 to 3 times blood pressure of a patient, and we diagnose hypertension also. So whenever you are a hypertensive, you should have some lifestyle modification also to decrease the blood pressure in your body. So what are the lifestyle changes you can do to decrease the blood pressure, to decrease the chronic kidney disease progression also? So first and important is the restriction of the salt. So whatever you eat, that is going to your body, and the body reacts accordingly. So when you take excess amount of salt in your body, like by taking salty foods or salty drinks, it may happen that there will be a high increase of salt in your body, and that will lead to retain the fluids in the body, and ultimately the blood volume will increase, and ultimately the hypertension can occur. So you have to avoid the extra salt intake. Usually that is recommended to take 6 to 8 gram of salt per day to a patient. And if you have kidney disease, then you also have to limit the salt as well as protein intake also, because excess of protein intake will lead to excess protein excretion in the body, and ultimately there will be decrease in the effective glomerular filtration rate. So by modifying our nutrition, by modifying our diet changes, we can reduce the blood pressure as well as chronic kidney disease. Second is intake of fat. Usually obesity is one of the major cause of development of hypertension as well as chronic kidney disease in our patients. So we have to restrict the fat intake. The trans fat intake must be avoided. The junk foods, the oily foods must be avoided. So you can take fruits, vegetables in a limited quantity. Sometimes you take fruits and vegetables in a limited quantity, but you take junk foods in high amounts, and that will lead to development of fat in your body. So deposition of fat will be high, and that will increase your obesity. So to decrease the weight of a patient, we have to decrease the carbohydrate intake, we have to decrease the fat intake. Total calorie intake should be reduced. Per kg body weight calorie intake is by the tune of 20 kilocalorie per kg. So if your weight is around 60, so you have to take 1200 to 1400 kilocalorie per day. If your weight is around 100, then you have to take 2000 kilocalorie per day. So if you want to reduce the weight, then you can reduce the calorie intake also. Secondly, intake of proteins. So protein intake, high intake of protein will lead to development of chronic kidney disease if you have proteinuria. So So if your kidney is not able to absorb the protein, it not able to filter the protein is leaking from your kidneys via the urine, then you have to restrict the protein intake also. Normally 1 gram per kg body weight protein intake is required for a normal person, but if you are suffering from kidney disease, it is reduced by 0.6 gram per kg body weight. So the next is, how can we know that what diet should be appropriate? So there is a specific diet pattern, that is dietary approach to stop hypertension, that is DASH diet. DASH diet is saying that you have to take less amount of salt, you have to restrict your fat, you have to restrict your carbohydrate intake, you have to take high amount of fruits and vegetables, as well as you have to restrict your protein intake also, and that will be a good diet for a hypertensive patient. So apart from the diet, exercise is very important to prevent hypertension as well as kidney disease. But severe or high intensity exercise are usually contraindicated in hypertensive patients, because sometimes there may be a sympathetic activity, stimulation will be there may be a chances of increase in heart rate. So usually what we prescribe to our patient to do a mild to moderate intensity exercises like 50 minutes or 60 minutes brisk walking is sufficient for a normal hypertensive patient if his blood pressure is under control. If blood pressure is high, then they should not go for walk. So they can take rest for some days, and if their blood pressure is under control, then they can go for walking also. And apart from the diet, exercise, medicine is very important to control the hypertension and kidney disease also. So in our prescription, we usually follow some guidelines for giving the medicine. And for the hypertensive patients who are more prone to develop kidney disease, ACE inhibitors and ARBs are the drug of choice. Apart from that, we can go for diuretics also, because diuretic will decrease the fluid retention from our body and improve the renal functions also. Diet, exercise, medicine, and the last one is monitoring, because sometimes what happens, you are not able to go to your doctor every week or every month. So monitoring in home is very important. We have to check your blood pressure regularly by a blood pressure instrument, or in a year you can go for the ambulatory blood pressure monitoring also. And as well as for the renal function, you have to see your urine output. If urine output is decreasing or urine output is excess, you should be very, very careful about that you may have kidney disease also. So in this way we can manage the hypertension and kidney disease, and we can prevent the progression of the disease. The patient may have hypertension, but patient can protect their kidneys by doing this lifestyle modification, by taking the regular exercise, and by doing the monitoring at home. Thank you very much.